Hi, this is Dr. Dewey McWhirter with Tranquility Sleep Specialists. Today I'm going to give you another Dr. Shuteye tip. Today we'll be talking about desensitization with CPAP. Desensitization is a process that you go through to get yourself more used to something that might cause some anxiety or might make you uncomfortable. This is a pretty common issue that happens when people are trying to use CPAP. It can be related to some sort of previous trauma where maybe someone's hand was over your mouth, or you were in some other situation where it was difficult to breathe, any sort of claustrophobic situation. Some people are just claustrophobic even without something like that happening. And sometimes it's just hard for people to get used to having this thing on. I mean, you went for, say, 25, 30 years of your life, maybe even 60 years of your life, and you didn't have anything like this on your face while you were sleeping, and now you got to get used to having something on your face while you're sleeping at night. Now, usually if people have issues like that, they'll initially try either what's called a nasal pillow that goes underneath their nose, or sometimes they'll try a nasal mask that goes around their nose. But sometimes those things don't work out. Sometimes it's just too hard for people to avoid breathing through their mouth at night. Sometimes it's hard for them to do that even if they're wearing a chin strap, or they're just not comfortable not being able to breathe through their mouth at night. When that's the case, they really do need to use a full face mask. I've purposely chosen one of the bigger full face masks today just because I want you to see that even if it's a bigger mask like this, you can get used to it. You can desensitize yourself to it and be more comfortable with it. There are smaller full face masks. There are ones that go around your mouth and then underneath your nose. And those are options as well if you have trouble with bigger masks. But this is one of the ones that even has a forehead pedestal on it to try to keep it stable and sealed well on your face. So what I always tell patients is if you are going to work on desensitization, I want you to find somewhere to do it, preferably not your bedroom. Some people feel fine about using the bedroom to do this, but I usually encourage them to find some other comfortable space, just because since this might be a little difficult for you at first, I don't want you to start thinking of the bed as an uncomfortable place, and that could generate you or cause you to have some other sleep issues. We don't want that to happen. So I really encourage people to choose some other comfortable space, maybe a couch or somewhere where they usually listen to music or read. I've chosen this big comfy chair today. Really anywhere that you tend to relax on a regular basis is a good spot. So some patients want to watch TV while they do this. Some will surf the internet. Some read a book. Whatever is relaxing to you is what I want you to try to do while you're doing this. So once you're feeling relaxed, then you start this process. I'm going to go through the entire process, and if you really are claustrophobic, you're really having a hard time with it, then you're going to start at the beginning of the process I'm going to describe. But if you're a little more comfortable, you can start a little farther into the process. This can take you hours or days or weeks even to gradually get used to it. I usually tell people to spend at least a few minutes a day, preferably 15 to 20 minutes, working on this as you're first getting used to the machine. I encourage you to do it longer if you actually are getting good success and you feel like you're making progress. If you're not making progress, then just try again the next day. This is a lifetime treatment. This is something we really want you to get used to so that you can use the machine for many years to come. I usually tell people, so the best thing to do if you're really having a hard time is start out with the mask just sitting next to you. It can have the tube on or off, whatever makes you more comfortable. You can take the straps off if that makes you more comfortable. And then you're going to kind of gradually work on getting it closer to your face. So if you're able to relax for a while with it sitting next to you, then you want to hold it in your hand. So you'll hold the mask in your hand, and then as you get more comfortable with that, you get it closer to your face, and then the next step will be a little bit closer. And eventually I want you to actually be holding it against your face. And as you are comfortable with that, then you continue to do that some more. If you get uncomfortable with it, you back up. You back up to the last step where you were comfortable, and give yourself a little more time at that step. Once you're holding it against your face, I want you to try to get to the point where you're comfortable actually putting the straps on so that you can have it on your face. And that's either with the air going or without the air going on, whatever is most comfortable for you. Having the air on is a gradual step as well. It's what is comfortable with you. So over time, hopefully this will help you to get desensitized and get to the point where you're more comfortable wearing the mask. We want everyone to have good success with treating their sleep apnea. So this is one step you can take if you're having problems. I hope this has helped you out today. I hope you'll join us again soon for our next Dr. Shuteye tip. Thanks for watching.